Happy Friday, everybody. Welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, plastic surgery and chronic pain. Can you get chronic pain from plastic surgery? We're going to talk about that. Then, a Texas physicians group is pushing for stricter regulations on med spas due to a patient's death. I have some choice things to say about this. And then finally, Sarah's going to tell us all about the benefits of walking. All this is coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really appreciate it. Please crush that like and subscribe button. It helps us a lot. I'm your host, plastic surgeon Dr. Bruce Hermann. Always. Sarah, how are you?
I'm so good.
You're so good?
Yeah.
Glad to hear it. Travis, how are you, buddy?
I'm really good.
It's been a long time. You doing good?
Yeah, I'm doing
so
good. I can't
long.
complain.
It's so long. Anything new in anybody's world?
4th of July.
4th of July, always a good time.
Yeah.
I'm just excited for how long is my weekend? 5-day weekend.
5-day weekends are
Yeah.
always a blast.
Yeah.
Yeah.
Didn't even have to put in PTO. It's going to be a good time.
Are you gonna rest or are you active on the 5-day weekend though?
I'm going to take, on Wednesday, the day that I'm off, I'm taking Avery paddle boarding.
Wow.
She's never been, but she's just now gotten comfortable, swim. She's gonna have a life jacket on, but she's just now gotten comfortable, swimming, in deep water
Oh,
Yeah.
okay.
with a life jacket,
different.
because that kind of freaks you out.
Oh, yeah.
It freaks me out a little bit.
Well,
but-
are you guys going to be in the ocean?
No, we're just gonna go to Lake Louisville or something.
You're going to paddleboard in Lake Louisville?
I do it all the time.
Oh my God, that is the worst. I grew up on Lake Louisville. That place
Maybe
is-
we'll go to Ray Roberts.
Yeah, I would go to Ray
That
Roberts.
one's prettier lake,
Dude, Lake
I guess.
Louisville is sketchy. Have you ever been to Lake Louisville, Travis?
I've never.
I grew up about a mile.
It's like the party lake.
Oh yeah, it's like party drunk
Actually,
boaters.
My boyfriend's little girl got a rash from the lake.
from being in the water.
Yeah.
Dude, you can go to Lake
it was
Louisville.
it looked like a spider webby.
You can go to Lake Louisville and just
veiny.
watch the fish dissolve in the water.
Oh no. Is that bad?
It's not quite that bad, but I mean, I'm talking travel. I grew up in Louisville. That's my hometown, and so I actually was a lake rat.
I don't mind it.
When I was a kid.
It's good enough.
It is a fun lake. There's a ton of people out there, and there's a
Mm-hmm.
lot of places to go if you like to party. But man, it's kind of like the Wild West out there.
Yeah.
Like-
People die out there.
Yeah, people die out there literally all the time. Like you have to be careful. Like,
It's
Yeah.
very interesting.
It's a massive lake. There's just tons of places to go.
Yeah.
But, well, paddleboarding, that's cool. I would
Yeah.
go to Ray Roberts if I were you.
I think
mean,
so.
It's a little bit more chill.
Yeah, it is. And then just 4th of July stuff. Avery will be with her dad, so
Yeah.
I'll be free to do grown-up things.
So I
guess.
unfortunately don't have a 5-day weekend, but we do have
Unfortunately.
vacation coming up. And
That's
so
nice.
we haven't quite finalized it, but I think we're going to do a cruise to Alaska.
Oh yeah, I think you told me about that. My mom and dad did that one
Did they?
time.
I did
They had
one when I
fun.
was little. I think I was 12 or 13 years old. And it's different, right? I mean, you're not stopping at beaches, but it's something different. The boat's really cool, so there's plenty to do on the boat. We're just trying to find something different. We end up either going to the beach or going on a cruise. We've done that for the last forever, many years. And so we're just trying to find something different.
Yeah, I'd be really scared about icebergs and stuff.
Icebergs? Yeah, I think these boats
That
are
would freak me out.
a little. Yeah, I mean there are icebergs up there. I remember when I did it before that we saw icebergs, but yeah, I don't think it's a huge risk like it was back in the Titanic days.
Yeah.
Yeah, I didn't even think about that. But yeah, I'm sure it'll be fine.
Nightmares.
I'm sure it'll be fine. Famous last words. So. All right, let's jump into some segments. So, I always, find topics to talk about based on news articles that I see. And this first topic comes from a news article that was about a research paper that came out a little bit earlier this year. It's not brand new, but it's within the past few months. And this is about plastic surgery and chronic pain. And the study comes out of Norway, and the study looked at a lot of different metrics, but one of the biggest metrics they were looking at is, okay, you had cosmetic surgery, and do you still have pain? And the study found that 1 out of 8 patients still had pain at 3 months.
Yeah.
And so I think did I put a slide in that's the article title, Charles? Yeah. No, that's the next one. That's the next one. Never mind. I thought I had another pick. There's not another one to this segment? I thought there was 2.
I didn't see one.
Okay. I must have just forgot to upload it. Anyway, all right. So the article basically frames this whole study as 1 in 8 plastic surgery patients have chronic pain, which I just, I see things like that, and I want to make sure that people know what that means, and it's not, to me, that has a very negative connotation.
Yeah.
Well, I mean, if I saw an article title that said, 1 out of 8 people that does X has chronic pain, I'd be like, well, X kind of sucks. I mean, that's a pretty high number.
Yeah.
And so I want to kind of break that down as to, is this a big thing or is it not? And so like the first question I would ask is, would it be unusual for a patient who had a plastic surgery to still have some amount of pain at 3 months? And my answer would be, I mean, it wouldn't be common, but I wouldn't say it's super rare either. But it just depends on a lot of different factors. And the factors that I would look at is, what are they quantifying as pain? Like, does that mean that if I reach down and pick up something heavy that I feel a twinge where I had my surgery? Is that post-op pain? I mean, you could have that for months and months, but does that mean you have chronic pain? Well, it just kind of depends on what your definition of chronic pain is. To me, when I think of somebody with chronic pain, I think of something that's really bothering someone.
Yeah, I think of somebody just like sitting there doing nothing and it's hurting them.
Yeah, right. Or it's enough of a hindrance that is affecting their daily life.
Yeah, well, they have to take Advil every day or something.
Yeah. So I think that, defining exactly what that means is important. I'd also ask, what surgery did they have? I mean, and I'm going to break this down for you because where I'm going to kind of go with this segment is I'm going to talk about some of the most popular plastic surgeries and what my thoughts are on like what the pain level would be and if chronic pain would be a concern. So I think what surgery, is important. And then of course the patient. I mean, every patient's different. I've done the same operation on 2 different people, and I would have one person tell me that the pain was a 1 out of 10 and somebody tell me it was 11 out of 10.
Yeah.
And it's the same operation. And so there is a little bit of subjectiveness to it. So as I said, I wanted to kind of break this down into surgeries as far as what do I think pain levels are for plastic surgery. Now, of course, non-plastic surgeries, I mean, they tend to be more painful because a lot of plastic surgeries operating on skin and fat. When you operate on skin and fat, the pain levels are generally pretty low. When you're doing orthopedic surgery operating on bone, that tends to have a much higher pain level. I had 2 knee surgeries, and man, the first one I had was pretty intense. Like I was on crutches for a month because it hurt so bad I couldn't even walk. Unfortunately, plastic surgery is not like that. So I broke these down into some different categories, and of course I didn't include every plastic surgery, but I just kind of hit the highlights. So ones I'd put in the easy category. So in the easy category, I would put first off breast implant exchanges. Super popular surgery. Last week we talked about the most popular plastic surgeries. Implant-based surgeries is number 1, although that does group in augmentation and implant exchanges. There's a lot of implant exchanges that happen. If you have breast implants and you go to get them swapped out, your pain level is going to be minimal to none. It's going to be very, very low. All the hard work's done. The pocket's there. You don't have to do a whole lot. One that I include in low pain is eyelid surgery. It's a very, very superficial surgery for the most part. Now, if people have different aspects, like say, for example, they have a very lax lid and you have to do a canthopexy, there's a little bit more pain associated with it. In general, eyelid surgery is pretty easy. I will put a footnote to that. The biggest kind of complaint with people with eyelid surgery is not pain, but swelling.
Okay.
Does
eyelid surgery include the top and the bottom?
It includes whatever you want to do.
But it's like either or both.
When I do eyelids, I probably do 20 uppers for every lower. Uppers are much, much more popular. And I like doing uppers better because overall, I mean, it's easier. I mean, to me, upper eyelids are one of the simplest things I do. I mean, you have to know what you're doing and you need to have done a certain number. But once you kind of get the hang of it, upper eyelids are pretty simple, I think. I mean, I've done tons of them and I don't think I've ever reoperated on an upper eyelid patient ever. But in general, the pain's not too high. Also in the pretty easy category, these are getting a little bit more intense, but still pretty easy. Breast augmentation, breast lift, breast reduction. All the breast surgeries are pretty easy. I know we've talked about you've had breast surgery before. So
Yes.
I'm not putting you on the spot. What did you think when you had breast surgery? Was it easy, hard, medium?
Well, my mom took care of me after I had it, so
Uh-huh.
that was nice for like the first like day.
Yeah.
Yeah.
But would you think it was like pretty intense surgery overall, or not too bad?
No,
Yeah.
I didn't. Nothing really, in terms of like long term, nothing really affected me. But I will say that like I lost some feeling like at the beneath right here.
Sure. Yeah, that's not uncommon
Below
at all.
that
Yeah, sensory
nipple
changes.
line.
Yeah, sensory changes is one of the biggest risks. Well, I mean, really with any surgery, but definitely with breast augmentation
Yeah, that's
surgery.
the only thing that
Yeah.
I ever noticed from it. Besides that, it's
Yeah.
great.
If I was going to rank breast surgery, so breast aug, breast lift, breast reduction, I put all those in the same category, honestly. I mean, if I was going to rank them on a 1 to 10, with 10 being the worst pain surgery and 1 being zero pain, I'd say it's probably a 3.
I mean, there's a reason why it's like the top surgery.
Exactly right. Yeah, you're
It's
100%
like,
right.
If it's there's the risk and
Yeah.
the reward,
Right.
outweigh each other, then it's not gonna happen.
Agree. All right, I'm going to move on to some of the moderate recoveries here. I would put liposuction in the moderate recovery. You know, if you get liposuction, you're going to be a little sore. It is just sucking out
kinda
fat,
like
but
beat me
generally,
up.
Huh?
Kind of like beats you up a little bit. You can
It
get
does.
bruises and stuff from it, right?
That plus when you're sucking the fat, you're generally sucking the fat layer that's up against the muscle layer, and you're coming at it from the bottom up, and so you will bang up the muscles a little bit, and so there is some soreness associated with that. I put arm lift and thigh lift in this medium category. You are just operating on skin and fat when you're doing arm lifts and thigh lifts, but because it's your arms and your legs, you use them all the time, and that makes it seem like they're more sore because you're using the area
Yeah,
that
that
has been
makes
operated
sense.
on. Yeah. The other one I put in the medium category is was nose jobs. Now, nose jobs can mean a lot of things. Like some nose jobs or rhinoplasties are very, very simple, and it's going to be very minimal pain, and some are super complex that actually you'll have a lot of pain. Like for example, if they're breaking bones, like that's
Yeah.
going to be more painful than if they're just like shaving cartilage. But in general, I threw them in the medium category. Like generally they're not terrible, but they're not super easy either. So higher level. I put facelift and neck lift in here. I think it's more towards the bottom of the more intense category. Like I don't think it's the worst. You know, the thing about the face is that, you know, it's lots of sensory nerves. When you operate on it, it can be sore. There's a lot of swelling,
Yeah.
which can
To
cause you
me,
pain.
whenever I see like pictures of people like after, like
Yeah.
right after, it looks like the most like
You can swell so much
serious.
from like a facelift and neck lift.
yeah, it looks like the most scary thing to do.
I tell my patients, I do some facelifts. You know, I specialize in breast and body, but I've kept up my skills in facelift and neck lift, so I still do them. I tell my patients that be prepared to not recognize yourself like on post-op day 1 or 2. Like
Yeah.
you could swell enough that you're not going to recognize yourself in the mirror.
And you're gonna be like, what did I do to
Yeah.
myself?
And you can be totally fine with that. I mean,
Yeah.
your face can swell a lot and you should be totally fine. The next one I put in here is BBL. Brazilian butt lift is a combination of liposuction and fat injecting. The reason I threw this one in the little bit more intense category is because when you're getting a BBL, generally they have to pull fat from a ton of different places. So it's like you're getting liposuction all over, and then they're injecting it back in, and then you're gonna have pain in your butt, which is hard because you're, you know, when you're sitting, and then all of the donor areas. So I think that, I don't do BBLs, but just based on what people told me, I think that's definitely a little bit more intense.
Yeah.
And then the big one, which I do the surgery literally all the time, I bet you know what it is.
Mommy makeovers.
Tummy tucks, yeah.
Yeah,
Tummy
tummy
tucks.
tucks. Yeah.
So the reason tummy tucks is always going to be in the top category for post-op pain is due to the repair of the muscles of the abdomen.
Yeah.
You know, when you tighten those muscles of the abdomen, which are core body muscles, right? So I'm using my core body muscles while I sit in this chair. It's keeping me from tipping over. I use them when you're walking. I mean, you're literally using your core body muscles anytime you're not laying flat. If you operate on those, and what I mean by operate is you're suturing them together to tighten them up, and then you're using them all the time, you're going to have pain.
Yeah.
And so I tell all my tummy tuck patients that you need to expect that you're going to be pretty sore, you know, for at least a week, if not 2, to where
Yeah.
you don't necessarily want to go to work and stuff. So, and also too, you know, we haven't really been talking about, you know, could you have chronic pain from this, which was one of the things we're going to talk about. I think of all the surgeries, the risk for having chronic pain would probably be the most for tummy tuck. You know, that's a really big suture that tightens up those abdominal muscles, and, you know, your muscles can be unhappy for months.
Yeah.
Now, realistically, what's the normal expectation? mean, with my patients with tummy tuck, generally by a month, they're going to say that they don't have pain.
Okay.
But versus like breast augmentation, would be in 2 days.
Yeah.
On average. So I think that, chronic pain, and like, I hate to say chronic pain, because to me, chronic pain is something that doesn't necessarily go away.
That's what I think of.
Yeah, right? I mean, when I think of chronic pain, which is why I just took issue with the way that this article was stated.
You think like chronic migraine, like something,
Yeah,
like you
something
wake
that-
up every morning with
Yeah,
a
something
migraine.
that doesn't go away,
Yeah.
If you're having pain from plastic surgery 6 months or a year down the road, there's something wrong.
Yeah, they forgot something in there.
Yeah, like, where's my car keys?
Yeah.
No, I mean, but you could have something like internal, like the classic one would be when people get contracture of a breast implant and they have pain from that, and it doesn't
Yeah.
go away because there's a problem, there's something
Yeah.
wrong. Or say you have a tummy tuck and you have a bleed and the surgeon doesn't notice it and you have this big hematoma in your abdomen.
Yeah.
That's going to cause you pain long term. I mean, if you have pain, past 3 months with plastic surgery, you
should be
need
going back to the
Yeah, you
doctor.
need to go back to your doctor and be like, hey, I'm having pain. Is this normal?
Yeah.
And so, and along those lines, the last thing I want to discuss is, what can cause long-term pain from plastic surgery? Complications. I mean, that's got to be number one. I mean, if something goes wrong and it's not addressed properly, or even if it is addressed properly, it can drag out your recovery time and you can have pain for longer periods. Another thing is if you're having too many surgeries at once. I mean, if you're having like 4 or 5 surgeries, which I am totally against, I've talked about that many times, that your complication rate absolutely goes up the more surgeries that you add.
Yeah, your body like can't handle that.
Yeah, right. And like you're gonna be recovering worse when you have multiple areas
And
that
slower.
are painful. Yeah, because think about this. If you go have surgery on one area, you're gonna baby that area. You're not gonna use it as much. But when you have surgery on multiple areas, it's harder to baby one area because your other areas can't compensate.
Yeah.
So having too many surgeries. Then major surgeries, once again, I said things like, tummy tuck, which I consider is pretty major, more likely to cause long-term pain. And then the last one would be is if people don't give themselves enough time to recoup, meaning they're too active.
Yeah.
I've had people that at 4 weeks are still swollen. I'm like, okay, well, what are you doing? It's like, oh, well, I'm back to my regular routine. I'm like mowing the lawn. I'm like, working in the garage. I'm like, oh, no wonder you're still having pain. No wonder you're still swollen. You didn't give yourself enough time to recoup. Let your body heal. Let yourself get back to normal before you jump back into doing heavy stuff.
Yeah.
So I don't know. I like to talk about that article because once again, when I saw how it was written, the article, not the research paper, it really kind of, to me, was not. It was kind of misleading.
Yeah.
It wasn't exactly how I would describe this, and I just want to make sure people are educated.
Yeah.
Like it's not fair to say that 1 out of 8 people have chronic pain after plastic surgery. Technically, it could be true depending on how you define it.
It should be pain for a month or 2.
Yeah, but I mean, to me, chronic pain means that there's something wrong.
Yeah.
I don't think 1 out of 8 people have something truly wrong. Do they have some soreness? Maybe. I'm off my soapbox now.
Okay.
Let's move on. Now, when I talked about this next segment, you thought that I was going to be upset with this. And this segment is about Texas physicians pushing for med spa regulation. And so that picture there is from the last segment that we did on this. I think it's the one before. Yeah, here we go. That should be the title one. Yeah, so. And the second picture, Travis, the reason I had that one is there because we talked about this incident.
Yeah.
This is the girl that died from the IV therapy. Do you remember that?
Okay. Yes, I do.
Was it like a year ago or was last summer maybe? It was almost a year. So there's been an update to that, sort of.
There was like something in it, right?
Right, yeah. We'll talk about it. So a Texas physician group is now pushing for greater med spa regulation in our state. The group is Texas 400, TX 400. I'd never heard of this group. It's an organization that wants to ensure patient safety and transparency in medicine. So I'm like, oh, that sounds like good things, right? I'm all about patient safety. I'm all about transparency. And this new push to regulate med spa is due to that incident that we talked about a year ago, where a patient named Jennifer Cleveland died from an IV treatment at a med spa because the IV bag, which was supposed to be just like hydration fluids and vitamins, actually had TPN. If you remember, TPN is the solution, like when you're getting fed through your vein.
Yeah.
So it's got lipids in it, it's got a bunch of electrolytes, and it's something that generally is given over a long period of time, and they slammed it in her, and because it has electrolytes in it, I'm pretty sure this is correct, I'm kind of just going from
Overly
memory
absorbed.
here. Yeah, it caused her heart to go into arrhythmia, and she died because there's potassium in it, and they gave it too fast. And it's like, why in the world were they given TPN? That's insane. That, and a lot of
Why
people.
is that? That's not normal to have it at med spa.
No, absolutely not. No, TPN is like what people get. Like, say you're like in a bad car wreck and you're in a coma.
Yeah, that's
And they
what
can't,
it's for.
Yeah, they can't feed you in your stomach. Or if you have pancreatitis, for example, like
Yeah.
the way you treat pancreatitis is you don't stimulate the gut. And so they feed you through your veins. That's what TPN is. I mean, and not to mention that TPN is white. Like, I don't know how they got this mixed up. Like, the IV bags are either clear or sometimes they'll have like a yellow tint because of the vitamins. But like TPN looks different because of what's in it.
Yeah.
Although maybe it's changed now. I don't know. Maybe it's not. I remember it being pretty opaque. Like, it was obvious it was TPN because you could see it hang. It's like, oh, that patient's on TPN.
Yeah.
So I'm really not sure
That's weird.
how that they messed that up. But, it comes from that there's not a lot of regulation.
Yeah.
So the Texas 400 says that there is too little regulation of med spas in Texas, and it's the Wild West, this was their quote, with very little supervision. And I absolutely agree with them. I do think that Texas, I don't think it's quite as bad as Florida. We're always dogging Florida about all the bad plastic surgery stuff that
All those
happens out
weirdos
there.
down there.
Texas is not far off from Florida as far as the lack of regulation. And that has bled over into med spas. What?
It makes me laugh.
Oh, well, yeah.
We're not far off from Florida.
I know, we got to be careful, man. We don't want to get to that level.
We need to do better.
Yeah, we need to do better. Texas 400, which once again is this physician groups, thinks that medical directors are one of the biggest issues with med spas. And I just literally 2 days ago heard a story. I don't want to say who said it because I don't want to find out where this is. But I heard a story of a med spa that's opening, and their medical director is a chiropractor. Does that make any sense whatsoever?
No.
Yeah, right? None. How can a chiropractor be a medical director?
Why is there any type of chiropractic services that are offered at a med spa besides massages? If there is, do you get massages at med spas?
I mean, you could have medical massage, but it's not common. No, I mean, med spa is generally medical treatments: Botox, fillers, lasers, microneedling, IV therapy. Like, these are medical treatments. When I heard that there was a chiropractor opening a med spa, I was like, what? How is that even possible?
That's very strange.
Well, and how is it even legal is like a better question. Well, it's because there's not enough regulation. And
yeah.
So Texas 400 is exactly right. Med spas offer medical treatments. This is not like going and getting your nails done. These are real medical treatments. Yeah. And the medical director, and this is just my opinion, the medical director should be the absolute most qualified person that does these procedures. Mm-hmm. So as you guys know, I run a med spa, and like prior to opening the med spa that I have, like we did med spa services in my surgery practice. Like, I'm always the one that people ask whenever there's a question, Yeah. If there's a question about Botox, there's a question about fillers, a question about the lasers, the machines, like I'm the one that has to know it. Like, I'm the one that should be the best at this. If you're a chiropractor, I mean, obviously they're not going to have any idea of what.
You're just there because you have the word doctor in front of your name?
Exactly. And I would say that like bleeds over into, and I'm not like dogging other specialties, but like if you're like a primary care doctor running a med spa, like what are you doing? I mean, you had zero training for doing these things when you were a resident. Like when I was a resident, we were trained how to do Botox, how to do fillers, how to run the machines that we have, because it's part of plastic surgery.
Yeah.
I would say that
your specialty.
Yeah, exactly. So, I think that when you have a medical director of a med spa, they absolutely should be able to talk intelligently about these treatments, and they should do them. Mm-hmm. And that is not the case. I mean, when going back to this case with that Jennifer Cleveland girl that died, I don't know if you guys remember, when we talked about that med spa, the director of that med spa had been there a total of 2 times, I believe, ever. And one of those times was right after the girl died. Basically, this person who was an anesthesiologist, if I remember correctly, was running this med spa, but literally was just hands off.
Yeah.
And so it's like, well, no wonder there was a bad outcome. I mean, if the person is not there, if the person doesn't even, know what procedures are happening, how can there be any safety?
Yeah.
So, I think the next question is who makes good directors of med spas? And I mean, this is going to sound biased, but I mean, I think the obvious answer, one, would be plastic surgeons, because we literally are taught how to do all these procedures.
Yes.
Like, it's literally part of our training. When I take my board certification, it will have questions about Botox. It'll have questions about fillers. It'll have questions about lasers. What other medical board has those questions? I think there only would be one, and that would be dermatology.
Yeah, that's the only other one I would
And
think
so
of.
I would say that, if you're going to a med spa and it's run by a dermatologist, you're probably good.
Yeah.
I'm not at all going to say that plastic surgeons are the only one that should be directors of med spas. But outside of plastic surgeons and dermatologists, I personally am not sure that these other doctors should be directors of med spa.
I feel like dermatologists, I would suspect that they have a limit on what they can actually do versus at yours, which is run by
Yeah, but I mean,
surgeon.
to be fair, to be totally fair and objective as I always try to be, I mean, I think a dermatologist can literally do anything that I would do in a med spa setting.
Cool.
I mean, like Botox, fillers, lasers. I don't know if they get as much of that in training. I'm not 100% sure that they get tested on their boards, but I think they do. When I talk to dermatologists, they always seem pretty knowledgeable. If I was going to have, if we were going to have med spa Jeopardy and you put a chiropractor and like a family practice doc up here, I'm going to annihilate them.
Yeah.
Because I just have so much more training and experience.
I would hope so.
And so, well, that brings into the question of, okay, well, if that's the case, then should these people be directors of these things? I don't know. I'm not sure that they should, or if they are, they should have to do specialty training to do that, which there's no restriction whatsoever.
That's crazy.
I mean, I know all kinds of doctors that are running med spas and people that are my friends even, and I'm like, how do you know, how do you feel like you know this stuff?
Yeah.
And they don't. They're relying on the nurse injectors and the estheticians that have gone and done these treatments to actually be the ones that do it and know about it. And that's crazy because ultimately they're responsible for these people.
Yeah.
So it's like, how is that correct?
No.
So I absolutely agree 100% with the Texas 400 that we need more regulation.
Is it with that med spa, it's like, I guess they purchased that lipid solution that you're talking about. It's like, is there any regulation on what a med spa business can buy in terms of medical supply?
That is a fantastic question.
Because then they shouldn't have never been able to buy that.
How did they get that? And I guess
that should be at a hospital,
right? But
not at a
I would
med
say
spa.
that the way that they got it is the same way that somebody that's on home TPN would get it.
Okay.
Because there are patients. So the one that pops to mind immediately is pancreatitis. Like if your pancreas acts up, you don't want to stimulate it with food.
Right.
But you don't necessarily have to be in the hospital. I mean, you will initially, but after a while, you'd be able to go home and you would want to take, TPN, so that's total parenteral nutrition. Yeah, and so there's going to be like a pharmacy that creates that stuff, and that's probably where they got it. It's probably the pharmacy where they were getting their IV bags for the stuff they should have been giving probably had TPN. They checked the wrong box. And there probably was a breakdown somewhere. It's like, the place that made this stuff up should be, why is a med spa ordering TPN? No one asked that question. And so there probably was more than one breakdown. But, ultimately, when you have a director of a med spa that's not even there oversighting people.
Mistakes will happen.
Yeah, mistakes are going to happen.
Bad ones,
I think the
apparently.
only reason there hasn't been like a huge outcry prior to this is that, to be fair, most of the stuff at the med spa has a low risk of death. I think of the stuff that we have like in our office, knock on wood, it would be hard for somebody to die from any treatment that we have in an office. Now, could you get jacked up? Sure. I mean, you could totally get botched if somebody, wasn't paying attention or if they didn't know what they were doing. I mean, you can get burned with a laser or with a broadband light treatment, easy enough. But outside of like this rare instance with the IV, there's not going to be a lot of deaths from med spas. I think you have a lot of unhappy people, people who get, complications that are maybe not like life altering.
Yeah.
But, I think that we have a duty to protect patients, and that doesn't necessarily always mean protect them from death. You could protect them from bad outcomes.
Yeah.
And if you have people that are supposed to be directors who really have no idea what they're doing and not even there, how is that safe? So I'm on board with you, Texas 400.
Yes.
I'll advocate for you guys. Maybe I should. I don't join any physicians groups. Like, I'm not even a member of the plastic surgery physicians group. There's like the American Society of, wait, what is it? APS.
You're not a part
American
of the
Society
plastic,
Surgery. Yeah.
plastic surgery club?
No, I didn't join it. And there's only like, I think if you look at the data, it's only 8% of plastic surgeons don't join it. And I'm in that group because I just don't like buy into it. It's like, it's like some people like to be in fraternities. Like, I mean, actually, I was in fraternities, so that's a bad example.
Like, wait,
that's a bad example. But like, it's like a club for doctors. I'm like, yeah, I'm good. Like, to me, there's just not a huge benefit to it. So yeah, I'm not in the AMA. I'm not in the ASPS. I just have zero interest in that. I was like, why was I even talking about it? Because Texas 400. Yeah. I might actually join them. I mean, they actually are out there trying to do something that I think is important. So yeah, I may have to look into that one. So you go Texas 400. I'm with you. More regulation on med spas. And also, people out there, just be careful. I mean, if you're going to go to a med spa, it is worth looking into who is the director of that med spa. Like, look at their background. If you look it up and it's plastic surgeons, dermatologists, you can feel pretty safe that med spa probably runs pretty well and that people know what they're doing because there's going to be a lot of oversight. If it's like a family practice doctor or a radiologist or a chiropractor, I personally wouldn't go there. I mean, that person really is not going to know all the things. Psychiatrist, yeah. So yeah, if you're going to go to a med spa and you want to have a good experience, I think it is important to check and see who's running it. It potentially can make a difference. So that's my speech, and I'm sticking to it.
Good.
All right, you're gonna educate us.
Oh yes, walking.
Walking. Yeah. I love walking. Well, actually, I don't. I like running, but walking is.
Yeah. We're gonna talk about some of the benefits. So key benefits we got here: physical, mental, social, and creative.
I like it.
Yeah.
We did a segment sort of like this that was how many extra steps you have to take for health benefits.
Yeah.
So this is different. So I'm interested.
Okay.
But I'm on board. So
obviously there's going to be health benefits because this is an exercise, which is, an exercise that we all do every day and we don't think about it. But when you do it with intention, it really helps you.
Yes. And so I would add to that adding, I think it was an extra, I'm trying to remember it in steps versus miles. I want to say if you add an extra 1.5 miles to 2 miles per day, it makes a very dramatic improvement in your overall health. Because we talked about things like weight loss, diabetes prevention. If you guys want to check it out, we could probably put a link up to the steps video because I had all of that data broken down. I've kind of forgot it, but I want to say that it was around adding 1.5 miles to 2 miles to your daily walking routine has enormous benefits.
Definitely.
Yeah, sorry, I didn't mean
and
to interrupt you.
So the physical health benefits, obviously it's low impact exercise.
Yes, that's
easy
very
on
important.
The joints and suitable for everyone.
Absolutely.
So you can start today. Travis can start today.
We all can start
today. Go on
a
walk. And just 30 minutes a day improves cardiovascular fitness, strengthens your bones, reduces body fat, and guess which type of body fat it reduces?
Visceral?
It does, which is like the one that causes all of these chronic diseases that people get in America all the time and everywhere all over the world.
I think that's one of the reasons, and I think it's multifactorial. I know it's multifactorial.
Because people don't walk around here. Everyone's got a car.
One of the reasons that Europeans
so far away.
Overall are better shape than Americans is everybody walks over there.
Yeah, the cities were built to walk.
But some of it's not our fault. I mean, think about this. Like, we live in the Dallas Metroplex. You can't walk anywhere. I can't even walk to a gas station from my house.
Yeah.
I mean, I guess theoretically I could if I wanted to spend 2 hours.
I would never. I don't want to walk right now outside though.
But like, when you live in Europe where everything is kind of centrally located, I mean, I walked all over Rome in the day, my wife and I did. You couldn't walk from my house to halfway here in a day. Like, it's too far in miles.
Yeah, it's crazy.
Everything's spread out in the United States. So some of it's not our fault.
Yeah.
So if you want to walk, you have to do it intentionally.
Yes, for 30 minutes a day.
Yeah, keep going, sorry.
No, you're good.
I got on a tangent.
The other part of it is it boosts muscle power, obviously, and endurance.
Yes.
So that's if you want to start being a runner, you need to
start
if you don't walk.
You got to walk before you run.
That's right.
Sometimes.
Got to build that endurance. So with all of that and reducing that body fat, it's obviously reducing visceral body fat, it's obviously going to decrease heart disease, high blood pressure, and type 2 diabetes.
Absolutely.
Yeah.
Yeah, we saw that. I'll have to dig up the data on that. But yeah, there was definitely a link towards intentional walking and decrease in obesity, heart disease, diabetes. Absolutely.
Yeah. So next we're going to move on to the mental health benefits.
Okay, this is where I don't know as much.
I think this is good. I think this is the best part because all exercise has a benefit for that on that side. It makes you feel good after you do that.
Yes.
Any type of exercise.
You feel like you've accomplished something.
It's hard to do it at the beginning, but
Totally.
afterwards you always feel better.
That is the truest thing ever because as I've talked about many times, I've had times in my life when I really was into working out and it's like, oh, I don't want to go work out today. But then you do it and you feel so good about yourself. You're like, I did something. I'm a good person.
It. Yeah, accomplished.
Yeah.
I like it. Obviously, I work out a lot, so I feel like if I haven't...
You make us all look bad, Sarah.
I feel like if I haven't worked out, then I haven't, completed my day.
You haven't completed your day, yeah.
Yeah.
I get that. There were times when I was like that.
Yeah.
Now's not one of those times.
And I was not always like that. But
so what got you into being like that? Is there any one particular thing or?
I noticed when I remember, I guess whenever I was a kid or younger, like adolescence, high school, that age, I was like, you think about like when you were like happy, like what was I doing that was so made me happy and blah, blah, blah. I was active every single day. I was doing gymnastics. I was moving. And I just noticed, one day I was like sitting on the couch, like I don't have like a hobby. I don't have anything that I'm like passionate about. And like, what was I passionate about before? Gymnastics. And that's like, something that was really important to me in my life. And then it just like went away because I couldn't do it in college or I couldn't be in Olympics or something. And then that, just all went away. So that's why I started doing CrossFit again.
Yeah.
Or CrossFit, not again, but yeah.
I got into it probably just for picking up girls. That's the reason I pretty much got into everything in my whole entire life.
For working out?
Yeah,
just to get muscles?
Yeah, right. Doing sports, like playing the guitar, working out. It was all about being able to pick up girls, yeah.
Hey,
I'm just being truthful.
Hey, whatever.
Right, Travis, didn't that motivate most men, right?
It absolutely
does. Okay, all right. Not just me.
And I'm like, now let's talk about y'all's mental health. You got to do it for you, main one, but so mental health benefits, it reduces symptoms of depression and anxiety.
Yes.
Gets out those bad feelings for sure. It releases endorphins, which are the mood lifters.
Yes.
And how it does that is from when you're walking outside, you feel you're out, I don't know, something about being outside, it just makes you feel good.
Alive. There's a lot more sense. It's funny, and I'm not going to, at the risk of derailing you, which I'm not going to do, I'm just going to say real quickly, that's one of the reasons I really enjoy riding motorcycles, because you get that extra sensation of like the wind and then smells, the feel of, it's very tactile. I would think running or walking in this instance, it's the same thing, right?
You start noticing things outside that you didn't notice
seeing
it before.
Stuff. Yeah. Like you have a lot more of experience. It's I get it. I mean, that's why I like to run too. I mean, running and walking to me is the same as far as they're very similar, right? It's just a different pace, but.
Yeah, being outside makes you feel good.
Yeah, I agree
100%. So the next thing is social benefits. Taking walks. It will lead to sometimes, making some friends.
Yeah.
Yeah.
Or like, I used to live.
Making you feel good that way too.
When I lived in Kentucky, when I was doing my general surgery training, we lived right next to an amazing park. I mean, it was awesome. And I would run around the park and there would be a bazillion people out there.
Yeah, and you start seeing the same people and then y'all start being like, hey, how's it going?
I know you.
Let's go get coffee after this and la la la. Yeah, totally. In my neighborhood, I see the same people like walking every morning. Yeah. And so it makes me be like, I should probably do that. Because one week I went for a run. And then I never did it again.
Oh, really? Yeah, but you're doing CrossFit. So
too much. I think it would really help me, though, to just walk and run. Yeah. Because
just to get out
CrossFit really, the way the workout the workout regimen is, it really makes you really stocky.
Yeah.
And not so lean.
Yeah.
So I've always been really stocky. So.
Well, you're a gymnast. I mean.
Yeah, but it's a gymnast. That's also why they're stocky, is because that's how
Yeah.
the workout is. But yeah, so some ways that you could be a part of that social thing is to do morning walks with your partner, lunchtime stroll with colleagues. So after your lunch, y'all go eat lunch.
Oh, yeah.
Do like a little digestive lunch walk.
Yeah.
It helps you digest your food, and so you won't get that like crash after you eat.
That's a really good idea. That's
Yeah.
something I hadn't thought about.
Yeah. And then an evening walk,
Mm-hmm.
you know, especially with your dog. That's
Yeah.
always good to do. I used to take my dogs for walks. So,
Our dogs are like insane
Yeah.
when we take them for walks. It's a workout.
yeah. And I think, and it also, in walking with your partner, it strengthens your relationship,
social
because most of
bonding.
the time hopefully you're not just walking looking at your phone.
Yeah. Yeah,
You're like,
talking.
you're walking and being like, hey, look at that tree.
Yeah.
Look at that bird.
Look at that house.
And then other things come up, you know?
Yep.
Other things happen. Speaking of other things come up when you're outside, you get a creative boost. I
hadn't heard that.
Yeah, so walking can spark creativity. The rhythm and change of scenery can clear the mind and open pathways to thought. So it's kind of almost like a meditation.
You know,
Like you're one
Now
with
that you
you're
mention that-
outside and
Yeah.
you're not thinking about,
yeah.
you know.
I would agree with that. So I equate things to running because I do more running than walking. But yeah, I get that. When I'm in the zone with running, like I start to, think about stuff, and I tend not to think about things like work,
Yeah.
just think about creative
You know
stuff.
what it reminds me of is whenever, you're driving and you realize that you've been driving the whole time without listening to the radio.
You've just been thinking.
You've just been thinking the whole
Yeah.
time. That's
Yeah.
what it reminds me of whenever if I'm running or walking outside or something. I just get in the mode of how long have I been out here?
Yeah.
Yeah.
I don't like to listen to music when I run. Now, when I lift weights, which I haven't done in a while, but when I lift weights, I like to listen to music. But when
Yeah.
I'm running, I don't.
Really?
No, I like the sounds of the outside.
Yeah. Sometimes I don't even think I'm listening to the music.
Yeah. Right, you have it
Whatever.
on, but you're not like.
Yeah,
paying
I don't
attention.
even
Yeah.
think I'm listening to it.
Yeah.
But yeah, that's pretty much what I found. I think it's super simple. It's something that's overlooked, and you
It
don't
is.
need a gym. You
Yeah.
just need to go outside.
The other thing too, the only thing I would add is when you think about, okay, I want to get the benefits of walking, I have to meet this certain, amount of walking. There are some simple ways, and you mentioned a lot of them, like go for a walk, like at lunch, go for a walk with your partner, take your dog for a walk. There are two things that I would add is one, when you're going places, park at the back of the parking lot.
Yeah.
It doesn't sound like
Take
a lot.
the stairs.
And that's the other one. Yep, that's exactly right. That was going to be the second one, is take the stairs. The one about parking in the back of the parking lot, like if you get into the habit of that and you go to a few places a day, I mean, you can easily add up to a mile, and then you're half or way there to getting that number of steps you need in that actually gives you those health benefits.
Yeah.
We always tend to park, as close as we can, but parking in the back of the parking lot, it's easy, it's convenient, there's always spaces there, and you just get into the habit of doing that. It makes a difference.
It does.
It adds up. The steps add up.
Yeah.
And you can also get little apps and stuff on your phone to keep track of your steps.
Yeah, I had so many steps whenever
Yeah.
I went to the Grand Canyon on
Oh, I
that
bet.
road trip.
Yeah.
Oof,
Yeah.
my phone was like, congratulations.
Yeah, you
I was
hit a
like,
new record.
oh.
No, that's really good information, Sarah. And that's why I like when you do these things, because you were looking at aspects that I didn't necessarily think of.
Yeah.
I wasn't thinking about the social creative. When I was looking at it from a doctor's standpoint, what
Yeah.
does it do for your heart and your
Yeah,
weight?
like bottom line,
Yeah.
what does it do?
So that's good. I like that different perspective. Thank you.
Yeah.
All right.
problem.
I guess that's all we have time for this
That it.
week. I want to thank everybody for watching. Thanks, Sarah, for throwing that segment out there. I felt like we learned a lot. Thanks, Travis in the box. Let us know what you guys want us to talk about. Leave us a comment. We want to hear from you. We'll see you next week.
Bye.
Bye.